I am Dr. Sritharan. I come from Sri Lanka. I'm an allopath. I'm an orthopedic surgeon, British qualified. I worked both in Britain and now in Sri Lanka. Attending Quantum University gives me a new meaning in life and a scientific basis for what I am trying to do in the future. I've been practicing integrative medicine for more than 30 years. And purely because the illnesses I had and my family had, the Western medicine could not solve it. And I ended up with going to an alternative person, and it changed the entire treatment that I practice and I believe in, and now I want a scientific basis for it. So Quantum University is now providing me for the scientific background for what I've been practicing, and now it will enhance my future practice, which I do totally free. My practice in Sri Lanka is orthopedic surgery, and that's what I do most of the time, 6 days a week. One day on a Sunday, I do totally free, non-orthopedic, non-allopathy, integrative medicine, which includes Ayurveda, Siddha, and acupressure. So, and I get a lot of satisfaction out of that. And these patients who are treated free by me are the poorest in the society and the luckiest in my practice. They get the best treatment from me. On Sunday, my free practice starts with I wake up at 4 as usual, and I leave home at 6 a.m. in a bus with my colleagues. There are 3 other West Allopath doctors, MBBS, MRCPs, FRCS, all traveling with me, 4 doctors, a pharmacist, and people who make the Ayurvedic medicine oils. We belong to a spiritual group, and we all travel together 50 kilometers out of Sri Lanka, out of Colombo. We reach there by 8 a.m. and we start the clinic sharp at 8. We see 100 to 200 patients till about 4 p.m. and we give everything free. At the moment, we don't do the investigation, but most of the drugs and treatment, advice, everything is done free. And that includes oils, exercise programs, diet programs. We combine a little allopathy because it's sometimes practical to use analgesics and anti-diabetics, but majority are herbal medicines that we use. And these patients give me the most satisfaction because we really make them get better, their own effort and our help. That's the 2 important things, not popping pills. I'm already a fully trained, fully British qualified surgeon practicing surgery, but my integrative medicine practice needs a scientific basis where it involves both herbals and mind medicine treatment. And I find this in the Quantum University teachings. And that's why I come for the Quantum University. And I also need a degree to certify my practice so that I don't have any legal issues with my allopath colleagues, so that I can survive the practice and help my patients. My personal vision is in the alternative medicine is that I believe that it is the medicine for chronic illnesses. For acute, yes, we need a combination, a marriage between the alternative and the allopathic for an emergency situation. But for a long-term basis, it's an alternative medicine, integrative medicine is the way. I passed out in 71, started orthopedics in 1972. The day I started getting blisters in my fingers, which I know now is called pumpholics. At that time, there was no medical diagnosis. Went from doctor to doctor for 2 months, no cure, and I was not allowed to enter the operating theater. Then I was taken to an integrative medicine doctor who cured me within 3 days. And I was thrilled, and that changed my outlook. And I started questioning what we were doing. It went on from there, and I have a spiritual master who guides me, and I have a lot of experience. I heard Professor Paul Druin talk yesterday about he was not allowed to enter the intensive care to treat his grandchild. I'm fortunate, in the hospital I practice, I treat all my nurses with integrative medicine. They come to me for it, and I can do anything in the intensive care unit. I'll give you one example. My brother had a cardiac arrest arrest with the infarction, and they went on doing cardiac massage for 15 minutes. Couldn't start the heart, they were going to stop it. At that moment, I received a herbal medicine, which is essentially ginger and honey. I got a nasogastric tube put into the stomach, and I shoved it in. Within 3 minutes, the heart started. He came back to life. And this is just one in the drop of the ocean that I have gone through, where the alternative medicine, even in the intensive care setup, has its very important place. We can save lives, save a lot of health.